Aloha, and welcome to our second episode of Talk Story with House Majority. My name is Della Belatti, and I serve as a House Majority Leader of the 30th Legislature of the state of Hawaii. This weekly webcast is designed as interviews with state executive leaders, community spotlights, and talk story conversations with my Democratic colleagues in the State House of Representatives. Today's theme is health and food security, two important topics as we head into the week 6 of the governor's stay-at-home orders. And just as a start, all of you out there continue to do your part to flatten the curve. Mahalo. Today, I will be joined by Dr. Melinda Ashton, Chief Quality Officer of Hawaii Pacific Health, that has hospitals and clinics across our state. Dr. Ashton, welcome.
Thank you.
So before we get into it, Dr. Ashton, can you tell us about Hawaii Pacific Health's healthcare footprint across the state?
Sure. We have 4 hospitals. We have Wilcox Medical Center on Kauai. We have Palimomi, Straub, and Kapiolani here on Oahu. And we have clinics scattered across the state.
So one of the reasons why I wanted to invite you is that I know that you are part of a team of physicians across the state representing the major hospital centers, representing all of the kind of specialties, pediatricians, OBGYNs, primary care doctors, also doctors and physicians in our long-term health facilities. You folks on a regular basis consult with Dr. Sarah Park, our state epidemiologist, so that the state really has a way of knowing what's happening outside there in the community. Is that accurate description?
Yeah, that's correct. We've been meeting now as a group for several years, actually. It wasn't in response to this pandemic, but over the years, we've had a number of issues that we talk about and we confer on. So Dr. Park gives us information about what Department of Health is doing, and we give her feedback about how that would be implemented across the state or what our impression would be of whatever the issue of the day is.
So that's really turning out to be a strength of Hawaii, this kind of close collaboration. And so, take me back to the initial start of all of this. February 26, 2020, the US has news of the first confirmed death from coronavirus in Seattle, Washington. What was happening here in Hawaii in our hospital community? And what was HPH doing in order to prepare? And what were the other hospitals doing to prepare?
Right. It seems so long ago now, and we've learned so much since then. It's really actually hard to go back and think, what were we doing? So what I did was I went back and I looked at all of our timeline and our notes of the activities that we had at HPH. And so actually it was the day after that we did our first HPH corporate emergency management meeting, where we gather the leaders across the system and say, hey, we think we've got something to worry about. Normally it's used for tsunami or earthquakes or that sort of thing. But for this, it was, things are not looking so good out there in the world. Think about China, think about Italy. We need to be prepared. We need to start planning. So that was the first of our meetings. We did that several weeks in a row. And then we said, okay, this is big. And so that's when we actually set up what we call our corporate command, where each of our hospitals and the HPH system, we've actually been in command centers, in rooms with key leaders in each of those areas so that we can talk to each other all day long. And it's 7 days a week to make sure that we're responding to whatever the issue is that comes up. So thinking back to the end of February, it's a long time ago, we were well aware that these events were occurring around the world, and then we began to plan on how we were going to respond.
So for the hospitals in particular, and I think this is important for the public, when we talk about flattening the curve, what does that mean for the hospital system?
Right. The issue with this pandemic is that no one in the world has had this virus before. So it means that any person is susceptible. And we know that 80%, or in Hawaii, 90% of people that catch this virus don't get very sick. But there are a number of people that get very, very sick. And what the problem is everybody gets the infection at the same time or within a very short period of time. The hospital system gets overwhelmed. There aren't enough beds. There aren't enough intensive care unit beds. There potentially wouldn't have been enough ventilators. So we're all capable of responding with the kind of care that these patients need, but we can't do it for everybody at the same time. So flattening the curve means having fewer people get the infection at the same time and spreading it out over time. And really, one of the goals is to spread it out long enough so that we have a vaccine or we have an effective treatment so that not everybody will end up in the hospital needing those beds.
So what Dr. Park has been saying in the public is that this is going to be a marathon, and we're really in the first phase of it, and that the stay-at-home orders were really important. So this is a coordinated effort on the part of hospitals, the healthcare system, state leaders, but then the public has its part in staying at home and helping flatten the curve. So from your perspective, while the public has been able to stay at home, what has been the effect of that in terms of how is it translated into what's happening at the hospital level?
What it's done for us as hospitals, it's allowed us to take really good care of those patients that have had the infection and other patients that need us for various reasons, and without getting overwhelmed. We haven't had that same scenario that we've seen so many other places around the world where there are, makeshift hospitals that have to be stood up and doctors and nurses dropping from infection. And we haven't had any of that. And so the activities of all of us have been very effective. But what that means is we've got a large amount of the population that hasn't had the virus, and we don't want them to get it. So we have to continue to be careful.
And so what we've seen is, again, our numbers. Every day, I think everyone anxiously watches what those numbers are. And I think today we only have a couple more cases, so we're up to maybe 611 positive cases. So as that continues to happen, there's this call and this urge to open up. Do you think we have the stronger capacities within our acute care setting? And what does it mean as these numbers continue to remain low? What does it mean for the gradual reopening of the healthcare system, if you can expand?
Right. I think the sustained low number means that we are in a place where we could begin to open up a little bit and begin to provide some of the healthcare that's been deferred, but also know that we still have capacity. So as we open up, what happens is more people are in contact with more people. And so if there is a virus in the community, it spreads. And as it spreads, some of those people will need healthcare in hospitals. And so as long as we do that gradually and pay attention to how it's working, we will have capacity to continue to care for those patients.
And within the healthcare setting, one of those gradual reopenings, if you can speak a little bit about the elective surgeries and elective procedures, what should the public know about that gradual reopening?
Right. So one of the things that we stopped doing back in the middle of March was in order to make sure that the hospital was ready for a possible surge of patients, we said we've got to make sure that we're not taking up beds with things that we could avoid. So patients that had surgeries scheduled suddenly had those surgeries canceled. We've continued to do urgent surgeries. So if someone's got something that has to be done right now, we'll do it. But we've put off everything else. And that means that there are patients out there potentially with some forms of cancer that need surgery or other kinds of things that could wait, but they can't wait forever. And so we're going to begin in the next few days, starting to have those patients come in and have their surgery. All of the hospitals are looking at how to do this responsibly. We want to do it gradually. It's not open the doors and have everybody come back, but begin to have those that are most urgent of those that were deferred begin to be performed. And keep an eye on how many of those patients end up needing a hospital bed, how many don't, where are we on our capacity, so that as we begin to open up other parts of our life, we want to make sure we've still got the ability to take care of patients that need us.
So really important, you guys have eyes on what's happening in the hospitals. What are your thoughts on the reopening of the local economy first, and then the reopening of the tourist economy? What are we going to need to be able to do these gradual reopenings?
I think we need to continue to monitor on a daily basis the way we have been, the number of patients that are testing positive. I think we all feel that if we open the local economy, the risk is relatively low. There's very little disease that we can identify in the community right now. So we think that opening up the local economy gradually makes a lot of sense. We all know, I think, that the risk is as we begin to invite visitors back, that some of those visitors will potentially have this virus, and we'll begin to see more small outbreaks. And we need to be very good at identifying those quickly with testing and tracing them, and then helping people to be isolated or quarantined appropriately so that we don't end up with a, explosion of illness.
So I want to remind our viewers, if you'd like to post questions in the facebook.com /Alelo community, please do that. We have Dr. Ashton, who's a wonderful expert in this arena about what's happening in our healthcare system broadly. If there's no questions, then what I would like to maybe ask Dr. Ashton is that what advice would you give to the public about what the new normal will look like within hospitals and across healthcare facilities, not just hospitals, but our long-term care homes?
Well, I think long-term care is going to be very careful to be monitoring visitors, limiting visitors, continuing to be careful about who they allow into their care facilities, monitoring their employees. And we've been very fortunate that we haven't had any outbreaks in our long-term care facilities, and I know they all want to keep it that way. So they're going to be very cautious. As far as the new normal in healthcare, we're expecting that at least the immediate term new normal is going to be that we will limit the number of people that we see. We are really happy with how well virtual care or medicine done over telehealth has worked out for us and for across the state, actually. And so we're very interested in making sure we maintain as much of that as makes sense. We know that we can't do everything by telehealth, but we can do a lot, and a lot more than people thought. And so I think the new normal will include a lot more telehealth than we had prior to this pandemic. And I think we'll see that waiting rooms won't be popular at all. We're going to be trying not to have people sitting in waiting rooms. We don't want that within 6 feet for long periods of time kind of contact. We want the physical distancing to continue.
I'm really happy you bring up the topic of telehealth, because I think we are seeing an explosion, and it's going to really help our rural patients, but even just patients across the board who are really busy and want to be able to maybe just call in and quickly consult with a doctor or a healthcare provider. I think on the policy side, we in the legislature will also have to examine telehealth policies and how we can support those efforts. So I know, again, this sense of collaboration. I know that the Department of Health is really leading the charge on the telehealth pilot program. We're wrapping up on our piece, Doctor. Is there any last minute final message you'd like to provide to our members? And before I do let you answer that, I just want to say it's been so amazing to see the recovered patients coming out of your institutions, out of Tripler, and then also to see the amazing people working for you. I just want to give a shout out to Dr. Morel Ver with Polymomi, who's been just a leader in the Filipino community and in the broader community at large. You folks have really been leading the way. So any final messages, Dr. Ashton?
I think the final message is that we're very grateful to the entire community for following the rules, staying home, really being responsible about what this has all been. And it's not been easy for anybody. It's hard for the healthcare workers too. They are nervous. They are worried. We've really been very pleased that we've been able to get through this without any issues with our healthcare task force. Being able to provide all the appropriate PPE and so forth has been really, really good for us. We've been happy about that. But I think really just everybody in the community has done their part, and I expect that we'll continue to see that.
Well, thank you again to Dr. Ashton from Hawai'i Pacific Health for joining us today on Talk Story with House Majority.